Antibiotic sensitivity testing, MIC breakpoints, and clinical decision-making. Antimicrobial resistance now accounts for an estimated 1.27 million deaths worldwide in 2020, driven largely by inappropriate antibiotic selection. Minimum inhibitory concentration, MIC, breakpoints translate in vitro susceptibility into actionable therapeutic thresholds by integrating pharmacokinetic/pharmacodynamic, PK/PD, targets, pathogen genetics, and clinical outcomes. Accurate determination of MICs, coupled with CLSI or EUCAST endorsed breakpoints, is essential for selecting optimal dosing regimens in infections ranging from uncomplicated urinary tract infection to septic shock. Integration of breakpoint data with patient-specific factors, renal function, site of infection, and comorbidities, optimizes efficacy while minimizing toxicity and resistance selection. Key points. Note: the 2023 CLSI breakpoint for vancomycin against Staphylococcus aureus is less than or equal to 2 g/ml, susceptible, 4 to 8 g/ml, intermediate, 8 g/ml, resistant, correlating with a 30-day mortality of 12% versus 22% when MIC equals 2 g/ml, IDSA 2023 MRSA guideline. For Enterococcus faecalis, ampicillin MIC less than or equal to 8 g/ml is susceptible. A breakpoint shift to less than or equal to 4 g/ml in 2022 EUCAST reduced inappropriate high-dose therapy by 18%. EUCAST 2022. Piperacillin tazobactam breakpoint for Pseudomonas aeruginosa is less than or equal to 16 g/ml, susceptible. Isolates with MIC equals 8 g/ml achieve greater than or equal to 90% probability of target attainment, PTA, when dosed 4.5 gq6h over 4h infusion. Ceftriaxone MIC less than or equal to 1 g/ml predicts greater than or equal to 95% clinical cure in community-acquired pneumonia, CAP, when given 2 g4q24h, CAP guideline, IDSA 2022. Daptomycin breakpoint for Staphylococcus aureus is less than or equal to 1 g/ml. High dose 10 mg per kilogram q24h improves bacteremia clearance from 78% to 92%. Daptomycin Study Group 2021. Vancomycin trough target of 15 to 20 g/ml is achieved in 84% of patients using 15 mg per kilogram q12h. Exceeding 20 g/ml raises acute kidney injury, AKI, risk to 18%, Ribach 2020. In patients with CRCL 30 to 50 ml/min, cefepime dose reduction to 1 gq12h maintains greater than 90% PTA for MIC equals 4 g/ml, renal dosing guidelines, FDA 2022. Linezolid breakpoint for Streptococcus pneumoniae is less than or equal to 0.5 g/ml. 600 mg POQ12H for 7 to 14 days yields 97% microbiologic eradication. Linezolid pneumonia trial 2020. Rapid phenotypic MIC testing, e.g., Accelerate Pheno, reduces time to optimal therapy by 22 hours, decreasing 30-day mortality from 19% to 13% in gram-negative sepsis, IDSA 2023. Implementation of antimicrobial stewardship protocols that enforce breakpoint-guided de-escalation reduces total antibiotic days by 1.4 days per admission, Stewardship Study 2021. Overview and epidemiology. Antibiotic sensitivity testing, AST, is the laboratory process that determines the minimum inhibitory concentration, MIC, of an antimicrobial agent required to inhibit visible growth of a bacterial isolate. The World Health Organization, WHO, classifies AST under ICD-10 code Z92.89, other prophylactic measures. Globally, antimicrobial resistance, AMR, caused an estimated 1.27 million deaths in 2020, representing 2.1% of all deaths, WHO Global Report 2021. In the United States, the Centers for Disease Control and Prevention, CDC, reported 2.8 million infections and 35,000 deaths attributable to resistant organisms in 2022, with a direct economic burden of $20 billion, CDC 2022. Europe recorded 670,000 resistant infections annually, with a median incidence of 12.5 per 100,000 population, ECDC 2022. Age distribution shows the highest incidence of resistant bloodstream infections in adults aged 65 to 84 years, incidence equals 18.3 per 100,000, and the lowest in children less than 5 years, incidence equals 3.2 per 100,000, CDC 2021. Sex-specific data reveal a modest male predominance, male-female ratio equals 1.3 to 1, for MRSA bacteremia, whereas Escherichia coli extended-spectrum beta-lactamase, ESBL, infections are slightly more common in females, 58% versus 42%. Klein 2020. Racial disparities are evident. African American patients experience a 1.5-fold higher rate of multidrug-resistant (MDR) urinary tract infection compared with white patients. Adjusted relative risk equals 1.5. 95% CI 1.3 to 1.8, Miller 2021. Pathophysiology. MIC breakpoints are rooted in the interplay between bacterial pharmacodynamics and host pharmacokinetics. At the molecular level, beta-lactam antibiotics bind penicillin-binding proteins, PBPs, inhibiting transpeptidation. The affinity constant, K_I, for PBP2A of MRSA is 0.8 m, necessitating higher plasma concentrations to achieve greater than or equal to 40% Ft-MIC, time-dependent killing. Genetic mutations such as MICA confer a PBP2A with reduced beta-lactam affinity, shifting the vancomycin breakpoint to less than or equal to 2g/ml. For fluoroquinolones, target mutations in GIRA, SER83-LU, raise the ciprofloxacin MIC by 4-fold, prompting EUCAST to lower the susceptible breakpoint from less than or equal to 0.5 g/ml to less than or equal to 0.25 g/ml in 2022. Pharmacokinetic/pharmacodynamic, PK/PD, indices, percent Ft-MIC for beta-lactams, AUC/MIC for vancomycin and fluoroquinolones, and C_max/MIC for aminoglycosides, drive breakpoint selection. For vancomycin, an AUC/MIC greater than or equal to 400, based on 24-hour AUC, correlates with a 90% probability of clinical success in MRSA bacteremia. This translates to a trough of 15 to 20 g/ml for a standard dose of 15 mg per kilogram Q12H in patients with normal renal function. Clinical presentation. The clinical manifestations of infections requiring AST are dictated by the pathogen, site, and host factors. In community-acquired pneumonia, CAP, caused by Streptococcus pneumoniae, the classic triad of cough, 85%, fever greater than or equal to 38.3 degrees Celsius, 78%, and dyspnea, 62%, is observed. Atypical presentations, such as confusion, 28%, and hypothermia, less than 36 degrees Celsius, 12%, are more frequent in patients greater than 80 years, p less than 0.01. In uncomplicated urinary tract infection, UTI, due to ESBL-producing E. coli, dysuria, 92%, and suprapubic tenderness, 68%, dominate, however. 19% of diabetic patients present with flank pain without fever, reflecting ascending infection. Physical examination sensitivity and specificity for bacteremia are limited. A temperature greater than or equal to 38.5 degrees Celsius has a sensitivity of 68% and specificity of 55% for positive blood cultures. Bacteremia Study 2022. The presence of a new murmur, specificity equals 96%, is a red flag for endocarditis, especially when coupled with a Janeway lesion, specificity equals 99%. Diagnosis. 1. Specimen collection. Obtain blood cultures, 2 sets, each with aerobic and anaerobic bottles, before antimicrobial initiation. The positivity rate for true bacteremia is 8% when drawn from peripheral sites, rising to 12% from central lines, CDC 2021. 2. Gram stain. Immediate gram stain provides a preliminary classification with a sensitivity of 84% and specificity of 92% for Staphylococcus spp. Laboratory Study 2020. 3. Mic determination. Perform broth microdilution, BMD, as the reference method. Automated systems, e.g., Vitec 2, have a categorical agreement of 96% with BMD for beta-lactams. CLSI 2023. 4. Interpretation using breakpoints. Apply CLSI 2023 breakpoints for the specific organism drug pair. For Enterobacter cloacae carbapenem susceptibility, the meropenem breakpoint is less than or equal to 1 g/ml, susceptible. 5. The PK/PD integration. Calculate AUC/mic or %Ft mic using patient's renal function, e.g., CRCL equals 45 ml per minute, to verify target attainment. Key points: complete blood count, CBC, leukocytosis 12 × 10/L, sensitivity equals 71%, suggests bacterial infection. Serum creatinine, baseline for dosing, a rise greater than 0.5 mg per deciliter from baseline after vancomycin indicates AKI, rifle criteria. Procalcitonin, levels greater than 0.5 nanograms per milliliter have a positive predictive value of 84% for bacterial sepsis. Greater than 2 nanograms per milliliter predicts higher mic isolates. Biomarker Study 2021. Chest CT, preferred for suspected necrotizing pneumonia, detects cavitation in 68% of MRSA cases versus 12% in MSSA. Radiology Review 2022. Management and treatment. Patients with sepsis or septic shock require immediate hemodynamic support. Target map greater than or equal to 65 mm. References. 1. By M. et al. Improving pharmacokinetic/pharmacodynamic outcomes of antimicrobial therapy for pneumonia in the ICU. Expert opinion on pharmacotherapy. 2024, 25, 18-2347-2365. PMID 395870056. https://pubmed.ncbi.nlm.nih.gov/395870056. doi 10.1080/14656566.2024.243248. 2. Tas J et al. Improving the ability of antimicrobial susceptibility tests to predict clinical outcome accurately, adding metabolic evasion to the equation. Drug Discovery Today. 2021, 26, 9/21/82-2189. PMID 341196667. https://pubmed.ncbi.nlm.nih.gov/341196667. DOI 10.1016/J.Drudis.2021.05.018. 3. Humphreys et al. Overview of changes to the Clinical and Laboratory Standards Institute Performance Standards for Antimicrobial Susceptibility Testing, M100, 31st edition. Journal of Clinical Microbiology. 2021, 59, 12E002131. PMID 345500809. https://pubmed.ncbi.nlm.nih.gov/345500809. doi 10.1128/JCM.00213-21. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.